And we're back after a brief break. You're watching South Texas Crossfire with your host, Attorney Joe Flores. Welcome back right here on KTMV, and special thanks to our sponsors. Without you all, this could not happen. And I'd like to take this time to thank God, our greatest sponsor. Of course, without him, nothing is possible. And we are here trying to get out a community message. We're here today with Attorney Juan Reyna, and we're talking about health care and the status of health care here in the nation, and with particular focus here in South Texas. Welcome back, Juan. How you doing, man?
I'm doing great, Joe.
Hey,
good to be back.
I appreciate you being here because your training, expertise, and knowledge in this area, representing doctors, representing consumers, this is foremost importance. Right now, as we were talking about people just joining us, we were talking about the $800 billion in the recent years that has been billed, and out of that, about a third is what Eric Holder, our Attorney General, is saying has been bilked out of the system. And we also talked about how healthcare providers can run awry, make mistakes, and how they can overbill, or people are just intentionally doing things, or the consumer is getting steered towards a certain agency or doctor or whatever. So let's start out with that. Let's talk about and break it down a little bit, some of the schemes out there that we've seen. And you mentioned upcoding, and I'd like the people up there to know what coding is. There are diagnostic related groups that started about 3 decades ago that came out, and on those groups there are diagnoses, and then you have ICD-9 coding, and which has gone and changed and evolved with certain diagnoses. And what my esteemed colleague was talking about is if you go to the doctor for sniffles, and then they're also, without you knowing it, some unscrupulous providers have been known to upcode, which it means to change the diagnosis to something more complicated. In other words, a 99213 basic visit, they would bill as a 99215 comprehensive visit. That's for an example. And so when you go in there, and there are red flags for the government, they start seeing, hey, we're being billed. 90% of his patients are complicated cases. Come on. So,
right.
I mean, let's talk about the ball rolling then. Then they could receive the complaint. The Office of the Inspector General, Department of Justice, everybody's looking at that. I think an investigation and an audit is warranted. Walk us through what you've seen in your training, experience, and knowledge in a general sense. I know you can't talk about specifics.
Well, that's typically where it leads. It leads to an audit. They want to go back. They want to examine the billing, do the chart reviews in order to determine whether or not this was legitimate or not. If it appears to them that it's rampant and it's just outright fraud and abuse, then it'll move on to that next query where, you know, DOJ or moves into kind of the criminal side of things. But for the most part, it's the civil side takes a hold first to do these type of reviews, these type of audits. Oftentimes, there can just be assessments and monies reimbursed, paid back to the government. There's ways of negotiating these things out, provided that it's not outright fraud, not systematic, but rather just kind of carelessness. Because you got to remember, I mean, it's easy to always sit there and want to be the armchair quarterback. That's easy. Hindsight's 20/20. We all know that. But when you're on the ground and you're very busy, you're understaffed, you got a bunch of patients who are not in the best of health, some terribly sick, and you're having to do your best under difficult, situations to provide the best care possible, and you're understaffed, and you're trying to wear all your hats at the same time. It is difficult. And I think the government understands that, and I think that's why they do allow for these type of reviews and these type of situations to want to be fair, even to the healthcare provider, as long as there's just not those rampant, systematic, fraudulent activities taking place.
You know, and I've been, without disclosing any details, facts, or anything, I've seen and been a part of hearing about investigations as you have. And what I hear over and over again from many of the governmental agencies is, we don't want to put people in jail.
Yeah.
We know the doctors worked hard 10, 12 years for their licenses.
Yeah.
We know agencies have worked 25 years. But if you see a problem, self-disclosure. Come and tell us about it.
Right.
That's the first step in having an integrity or a relationship of integrity with those agencies, because it's their dollars. This isn't like any other business. You're dealing with government dollars. It's just like defense contracts.
That's right.
I mean, the taxpayer is paying for this. And now more than ever, I've talked to physicians who say, I don't want to take Medicare anymore. I don't want to take Medicare patients. I'm getting paid a third less. I'm waiting on payments 3 to 6 months. On top of that, they're auditing. And obviously on the other side, the healthcare providers are saying they just want their money because they made some bad investments, bad choices. America is in dire straits. And first, we limited legal rights, and tort reform system and lawyers not being able to sue on certain things. Now we're going to focus in on healthcare, and we're going to get back those monies that we did. Now that's a jaded view, but it might hold some validity that the government does indeed say, well, we let people get away with making DME companies with a door name on it, nobody in there working, and they were just billing falsely.
That's right.
And they've had enough.
That's right.
And really, they didn't have the manpower or the staff, and the administration now said, we're going to give you the tools to go out there and prosecute healthcare fraud.
And I think you'll see an emphasis back towards these type of focuses, especially as perhaps our participation in some of these foreign excursions, we start withdrawing, those resources then will get diverted. Much of the law enforcement, as you are well aware, Joe, being a federal practitioner over the last 10 years, has been focused on issues related to Homeland Security and the global war on terror and the two wars that this country has been engaged in over the last decade. But as that ever so slowly draws to a close, especially the two, Afghanistan and Iraq, I think a lot of federal resources are going to start being rediverted to ensuring quality healthcare compliance. You see a lot of this in the president's new bill, which became law in terms of Obamacare, and you're just going to see a lot more teeth in the enforcement mechanism to want to weed out the rampant fraud that's taken place within the system.
Well, and you're hearing of things like not just billing by doctor. I don't want to pick on doctors by any means, but you're seeing unscrupulous home health providers going and giving gifts of cash, of non-cash presents and items and incentives to stay with our company.
Right.
You know, we've heard anecdotally and also seen that the media has hit that patients are being given incentives to stay with a certain company.
Right.
The law is very clear that there are no kickbacks or gifts to the patient.
Right.
And so, some of those schemes can even lead to prison and things. Even the things that would be acceptable in other businesses just aren't acceptable in healthcare. What do you think some of the remedies are for that? Or if you're a home health agency or a business out there, what can be done to prevent from going awry on these kind of things?
Well, I definitely think that healthcare agencies, home health agencies, I think it's imperative that they get competent legal counsel to help ensure compliance with all these federal rules and regulations. I think that's key. Engage a counsel of your choice to provide you with good quality control mechanisms, with periodic reviews, continuing legal education in terms of what is demanded, whether, at least taking place quarterly. Bring your staff together, bring your counsel in to review with the staff about what is required, what is demanded. I think that's very important to ensure that what's taking place operationally on the ground is compliant. Oftentimes what you find with these home health care agencies, there is no hard, fast rule that says, well, you have to be a physician to own one, or that you have to have a decade's worth of experience in healthcare to own one. You could be a layperson, you see, and then what ends up happening, of course, is that there's this whole body of law out there that demands strict compliance that perhaps you're very much unaware of.
Yeah, exactly right. For years, what I've seen, over 20 years and more, is that home health said, we don't need lawyers. We don't need to waste money on lawyers. But now, with the government saying all these practices you thought were legal, the high, you know, they've been giving trips. Like the pharmaceutical industry has taken a big slap, and they still are, by buying trips
Right.
for doctors to give symposiums, to promote a certain drug in an off-label manner. They've had enough.
Right.
Same thing in home health. For years that I've seen and heard people that were saying, well, I'm a marketing director, I'm going to take these docs out to Europe or Paris or something, and then they're going to send me all these patients. That's an anti-kickback violation in the worst way that can lead to 5 years in prison, $25,000 per offense.
Well, I think, you know, those, I mean, that's always scary when you put it in those terms, but that is but that is the reality.
It's horrible.
Now, but I think the most important thing is for home health care providers and owners, you know, you always hear, you know, there's always these consultants who want to charge an arm and a leg and want to feed you a bunch of forms, and, you know, to somehow ensure that your books are in order. But if your books are in order, but what is taking place operationally on the ground is out of order, hard for consultants to fix that. And I think given the choice between the two, far better off with competent legal counsel to help give you the type of counsel and advice that you would need operationally, day to day, to help ensure compliance. And there are a number of very fine healthcare lawyers out there, and I think it goes, fits hand in glove in terms of what these consultants do. I think now, given this new focus by the feds to ensure strict compliance, I think it's very much needed to have that competent legal counsel at this time as well.
Well, we've got a couple of minutes left, but I want to underline that we're taking it very seriously here at South Texas Crossfire, that the consumer out there, if you're patient, don't let anybody tell you what doctor you can go to, what home health you need to choose, what services you need to be provided for. You're in a hospital scenario, you're sick, you haven't felt good, you're getting discharged. Oh, look at this company A or company B or company C. You should choose these or choose this one instead. Don't let somebody say that. We have patient choice. Consult with your family. Always have somebody there with you, a companion. And for those agencies out there that are concerned, you should be, and physicians and healthcare providers, we wanted to bring this message out to address both sides, the medical camp and the consumer, and let them know that there are measures in place that can prevent, you know, unintended results such as healthcare fraud, and let those people out there know that are doing it intentionally or trying to take advantage of the public trust, that they're coming after you. So with that, we have brought on a great message. Juan, Reyna, attorney at law, thank you always for coming by.
Pleasure, Joe.
Yes, and also we'll have a little message after this show on healthcare fraud and the importance of knowing your healthcare rights. So this is Joe Flores signing off. Thank you so much, and God bless.